Felix.
I'm Robert Kirabo Nyonyintono.
It's glory for Uganda for the first time in history.
Anything in sports, join me.
Wake up to Good Morning Uganda, weekdays on UBC.
Live from Nile Avenue in UBC Studios, this is Good Morning Uganda.
When you talk about our motherland Uganda, the Pearl of Africa, you cannot fail to smile because of the smile that fills the faces of the citizens. Our nice good weather and nature that sustains us all, that enables us all to continue each in their own way because we are all different even according to each individual's work. But what joins us to become one person is the sweetness from the flavored drink Alleluia Jingati drink and Alleluia Tamarind drink. The flavor that quenches your thirst while at the same time treating and healing your body because it is 100% natural. Enjoy the drink that has got the tamarind juice in it. Made by Alleluia Reflexology, Healthy Solutions and Nutritional Research Center Limited. Get yourself a bottle of Alleluia from all shops around.
Live from UBC Studios in Kampala. This is Good Morning Uganda.
A lovely morning to you, and thank you so much for making the best choice to begin with us this morning. It is Good Morning Uganda, your current affairs show where we make it a point that despite being home, you're well versed with what is happening locally and internationally. We must remind you that we are in a time of COVID-19, and what is your best priority as you go about business is to ensure that you start your day alive and end it alive without contracting COVID-19. In case you're on treatment, we urge you please stick to your treatment and be kind enough to self-isolate yourself, because once you do that, that is the only way we can prevent spreading the disease to other people. I'm Robert Kirabo Nyonyintono. Once again, welcome to Good Morning Uganda. But I'm not doing this alone. I'm with my brother, that is Felix Nkunda, with whom we are going to be taking you through this program from 6:30 till the hour of 9, when Ruben will be here to crown it all with the world of sports. A lovely morning to you, Felix.
Morning, Robert. How are you? Now, I do normally want to start once in a while putting on my mask, and just this as a reminder to all our viewers out there that guess what? 2-3 years ago, this would be show off. If you met someone in town putting on a mask, you'd be thinking Bekozachi, like they're not Africans. You know, it was like not part of our livelihood. Like it was only for people who are medical workers, probably who work actually in theater, people in case you're in a place that has so much dust. But guess what? Up till today, it's the way for us to survive. Now, I want to urge everyone out there that when you decide to get out of your house and move in any place that is not part of your personal confinement, please endeavor to wear a face mask. And when you're wearing it, I have seen people put on their face masks down their chin. I know it gives you hardness in breath. Sometimes some people put them on their foreheads. The protection needed for this mask is supposed to be for your nose and mouth. Let us carry out these drills. Together we are winning COVID-19. And that's a matter of fact. If you look at the statistics most recent, the death rate has fairly gone down. The people who are curing from COVID-19, numbers are increasing day by day. Let us work together to be able to kick out COVID-19, because I believe together we can actually win COVID-19. Nevertheless, I want to say good morning to you all our viewers, and Robert, and of course everyone watching us from home, streaming live on our Facebook, Twitter, but also on YouTube. We're back here to give you the action as it is. We'll be of course taking you through our current affairs, international stories, but also sports, and then of course the weather lovers. Mollen will be here to give us weather updates, and of course traffic updates. Now I will ask you to accept me to remove my mask, because Kirabo is kilometers away from me. But also, something quite interesting did happen, Robert. If you did notice, most recent, we've been having these whoos between the practitioners. Like doctors have come out time and again to talk about their plight. Yesterday we did a story about Parliament's proposal. But if you're to be taken back in time, I meant to ask you, what is the cost, depending on what COVID has exploited, that you wouldn't ever think of studying or doing in terms like this? What is that cost you don't think that I think may become not useful, or people will drop it after COVID?
I would look at education. Many people after some time may not, if we see the intakes at universities, maybe those choosing education could kind of reduce because of what people have experienced. Whenever it comes, first area considered in terms of congestion would be that. Yes.
Well, it's tricky. Well, of course, I know with the disappointment that has come with teachers, or probably what you want to call the education sector in particular, people may not be very much motivated to go that way. But also, in times like this, you do find that some of the most admired courses, like even medicine, have also gotten people to think twice, like, okay. And then when it comes to being essential as a worker, you look at some courses and no one talks about them. I don't know what kind of courses those are, and we won't discuss them on air. But nevertheless, that and more is what we'll be giving you here on Good Morning Uganda. Robert does have a couple of stories that were trending or that did make news in the last 24 hours. And of course, we'll also be coming in with our international stories. But for now, let us look at our local stories.
We begin with His Excellency, the President of the Republic of Uganda, calling upon other heads in the East African community states to ensure they fast-track the East African community before he can finally go and rear his cows. President Yoweri Museveni called on East African leaders to fast-track the East African Federation and create a center of gravity for Africa before he goes to look after his cows. The president was responding to comments by Kenyan Vice President William Ruto that he owed them a debt of seeing the fruits of East African Federation before he retires. Uganda, using a Uganda proverb, akagamba kalungi, a good word that made the hyena sleep near the homestead. It goes that a hyena was behind a homestead and heard them saying they are going to slaughter an animal tomorrow. It made the hyena sleep near the home for many nights. President Museveni said the two countries, he said that two continents in America, that is North America, has 3 countries, that is Canada, USA, and Mexico, while South America has about 20 countries, and this is the power of unity. Ministry of Finance, Planning and Economic Development has released a 5.7 trillion for Q1 expenditure. The funds, representing 25% of the approved budget for the current financial year, include appropriation in aid and public debt. As a consequence of the projected shortfall in revenue of about 1.8 to 2 trillion shillings in the current financial year and the need for urgent intervention to help combat the spread of the coronavirus, government has approved an addition of 600 billion shillings in the first quarter disbursement. The budget of most ministries, departments, and government agencies have been suppressed by up to 41.2%. Some of the non-essential areas where the supplementary resources were raised include freezing of travel abroad, workshops, and seminars. Some of the key highlights of Q1 release include allocation of a supplementary expenditure of 206 billion shillings to the health sector and provision of nurses and midwives allowances. Deceased veteran politician Aggrey Awori has been described by a section of members of parliament as an irreplaceable legislator. Awori, a former presidential candidate and Minister for Information, is said to have succumbed to COVID-19. Former woman member of parliament for Ngora district, Jacqueline Amongin, said his health leaves a leadership gap not just in Uganda but East Africa. He, however, over some time, we've seen comments on social media declaring him as dead, which he has continuously refuted. However, when similar rumors hit social media on Monday this week, he could neither refute them nor deny it. It's confirmed his demise, to shock of many Ugandans, including members of parliament. Aggrey Awori came into limelight. That was when he wanted to become Uganda's president in 2001, a bid he lost to incumbent Yoweri Kaguta Museveni. He, however, settled for parliament, where he became one of the most vocal legislators of all times. Government has pushed the day for the vulnerable persons hit by the lockdown to start receiving funds to Thursday this week. The Minister for Gender, Labour and Social Development, Betty Amongi, said the delay has been caused by a slowdown of local council authority to feed the required data. They said the Gender Ministry had not received enough data from local authorities to start sending money to the vulnerable poor hit by the COVID-19 lockdown. The minister added that they were also battling legal issues concerning data of the beneficiaries that also needed to be cleared first. The Minister for ICT also revealed that talks are ongoing between government and financial institutions to urge them review loan terms so as not to harass defaulters during the lockdown. The landlords were also urged not to harass their tenants during the lockdown. According to earlier plans by government, the disbursement of the funds should have started yesterday, which was Tuesday. And finally, from local stories, we look at private healthcare providers who want government to involve them in the procurement of vaccines and other essential COVID-19 supplies. They said this will see a large percentage of Ugandans vaccinated to fight COVID-19. It is said private hospitals charge between 3 million and 5 million per day for a patient needing oxygen in intensive care and high dependency units. Led by Miss Grace Salichiwanuka, the Executive Director of Uganda Healthcare Foundation, the umbrella body for private hospitals in the health sector in the country, they labor to justify to the committee what brings about the high cost of treatment. However, a section of members of parliament disagreed with what they had put on table as reasons. These also decried the unfair treatment by security personnel, which also has left many of their colleagues arrested, yet they were providing essential services. The National Parliamentary COVID-19 Task Force Committee is expected to embark on a countrywide tour to seek solutions into proper management of the pandemic. Government is targeting to vaccinate 22 million Ugandans above the age of 18. Wow. And those are some of the stories that we were able to get you that were in our bulletins yesterday. I now hand you to Felix to take us through what is trending on the international scene.
Well, of course, now looking at international stories, are not far from the story of doctors. In India, COVID doctors demand action after a couple of attacks. Now, one of the doctors, that is Dr. Kumar, vividly remembers the afternoon early June where he thought he would die, where he had gone through the attack. Now, it was his first job and his second day at work at COVID Care Center in Haujai district in India, northeastern state of Assam. Now, he was asked to check a patient who had been admitted that morning. When he did, he found him unresponsive. The patient's family was furious when he told them that the man had died, and in moments, the doctor, all hell broke loose, and he said they started hurling chairs around the room and breaking windows and abusing the staff. Now, this has been an attack on medical practitioners in this way, where people have been becoming hostile against doctors and blaming them for the loss of their loved ones and family members. Now, crossing over to America, where we see Biden's administration comes out to extend temporary protected status for Yemenis in U.S. Biden's administration has extended a program that allows Yemenis already in the United States to stay in the country without fear of deportation, saying the ongoing conflict is a humanitarian crisis in Yemen, makes it unsafe for them to return home. Now, the renewed designation of a temporary protected status will allow approximately 17,000 Yemenis to keep their status through March 20 up to March 3rd, 2023, and allow an estimated 480 additional Yemenis to apply, the Department of Homeland Security said the statement. Now, Yemen's, of course, it is a bitter pill to swallow. Saudi grapples with Yemen's peace deal-led coalition, says they intercepted Houthi drone that is in the Yemen again, that was released by the UN. Now, Yemen continues to experience worsening humanitarian and economic conditions that prevent individuals from safely returning to their homes. Secretary of the US came out to make mention, and he also added that ongoing armed conflict in Yemen the people there lack access to food, water, and health care, as well as COVID-19 pandemic also is worsening in the region. Now back to Africa. We'll be looking at South Africa. While we will be looking at South Africa's Jacob Zuma urges court to stop his arrest, and he came out to say that the regional court blocks his arrest as he pursues legal challenge against the prison sentence. The development came on Tuesday, as a week after the Constitutional Court sentenced Zuma to a 15-month jail term for contempt of court after he defied all orders to give evidence at a corruption inquiry in February. Now, the court instructed police to arrest Zuma by the end of Wednesday if he did not hand himself in, sparking angry reaction from Zuma's supporters and lying bare deep divisions in governing African National Congress Party. But late last week, Zuma asked the Constitutional Court to cancel his sentence and approached the High Court for an interdiction to prevent police from arresting him until the Constitutional Court hears his rescission application on the 12th of July. The legal arguments before the Pietermaritzburg High Court, Zuma's lawyers, Dali Mpofu, on Tuesday, urged that the former president would turn 80 on his next birthday. His health condition is not actually constant, and preciously, he also was not a flight risk as he was under the care and security of the state. The argument gained short shrift from the anti-corruption panel that Zuma snubbed. Well, that's basically what's in the international scene. Very much of some of those stories are relative to what we've been talking about. Of course, there's more again in Nigeria about the kids and the girls who are taken by a particular group of gunmen, cross down to Mali. Something quite similar if you go also in the Tigray region, while we see the conflict is still on with the Ethiopian, of course, forces there. But that and much is what we'll be giving you throughout our program. Remember, you can follow us on Facebook, Twitter, also on YouTube. You can catch us, also leave a comment in case you have any reactions to make about our production. Now we'll take a break, have a song for the day that is meant to encourage you, pick you up and give you momentum to continue and start out your day. But when we come back, me and Robert will be looking at our newsreel story. Good morning.
Research Center Limited. Get yourself a bottle of Hallelujah from all shops around.
Airtel Uganda has the best and most affordable rates when it comes to withdrawing and sending money. Withdraw money for as low as 330 shillings up to a maximum of 12,500 shillings. Sending money is just as affordable as ever. Absolutely unbeatable. Use Airtel Money on the most affordable network with the largest network of Airtel Money branches in Uganda. Dial *185# to get started. Airtel Money. Simple, secure, borderless.
It's no secret that ICT makes learning easy.
The strides made in our field couldn't be possible without it.
And now we can watch our favorite shows.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC supports local content and innovations. Driving the development of a robust communication sector in Uganda is Uganda Communications Commission.
Live from UBC Studios in Kampala. This is Good Morning Uganda.
Good morning once again, and of course, thank you so much. We cannot get tired of thanking you for making us a TV of choice this morning. But also, we don't forget to remind you that prevention is better than cure. So please perfect the art of ensuring that you follow the soaps. They're very simple. A mask, a bar of soap, water are some of the things that can save you millions of monies that we are going to be discussing in this program once you test positive of COVID-19. But also the good news is to allay the fears is Uganda, we've registered success. Just in the last 7 days, over 4,000 people have recovered from COVID-19. So to those that are sick, there is hope that you will recover if you have the right treatment given to you. Now in our usual story, we are going to be looking at that is what many Ugandans view as exorbitant fees being charged by private hospitals to treat COVID-19. Yesterday, they interfaced, that is with the Parliamentary Task Force on COVID-19 led by Honorable Abdul Katuntu, and they were explaining why would one spend from 3 million to 5 million on treatment per day if they go to intensive care unit. And when we look at some of the reasons they gave, and of course what the committee took, we are trying to see is this justifiable. If it is, then what can be done? They went ahead and urged government to include them in the purchase of vaccines to ensure that a couple of Ugandans can get vaccinated in this public-private partnership once it goes through. Felix, we know that COVID-19 has not only robbed Ugandans of people, of their loved ones, but also of huge resources. Many have recovered, some have succumbed to COVID, but bills have been paid.
Well, Robert, this discussion has been around for quite a time, I must also say that. However, the true diagnosis, if I'm to use a medical term, since we are talking about medical practitioners, the true diagnosis of this problem or the challenge hasn't been touched. Yesterday, I made comment about the aspect of standardizing healthcare away from just dealing with solutions, or rather symptoms, if you want, if I beg your pardon, symptoms or small signs of a defunct health system. While we talked about, they had suggested to give people, the families of those who did lose their loved ones in terms of being medical practitioners, to give them money. These are some of those pockets we must deal with on a general spectrum. previously I've also said to you that some of the areas of practice in a country or in any civilized state must be under the confines of public order. All right? And as a matter of fact, that will bring into play the notion of hospitals, among the many others. Now, the day you choose to have, so on a spectrum of 100, you have probably 10, let's say 20% of healthcare facilitators or service providers being private. It means that you have accepted to give that sector away. Now, once you accept to give it away, there are other two options. You can add if you want. But one, you're either giving it away to well-wishers. That's why you see, that's where the church comes in. Or aid-based institutions. You have NGOs, have hospitals, you know, but those are most times specialized hospitals and all that. But then also, on the other hand, by far, you have the private sector. Now, the private sector doesn't go into investing for purposes of national growth or to promote your agenda as an institution. It only allows such investment for their latter interest, which economically would be profits. Now, any business, if you want to discuss this in terms of economics, will do anything it can to cause maximization of profits. And this is only evident when you relate with time and seasons. You get the point? Now, there are hospitals that will never get a patient in a week. But they still have to pay the operational fee, costs and all that. You understand? Now, this is related to seasons. As you see in December, it is easier for people to sell Christmas cards. But that's the only time they can sell
Christmas cards.
Or Christmas trees.
Who would be buying one at such a time?
For example, really, if I found you Kirabo buying a Christmas tree today, I would think.
I'm preparing for Christmas. When the prices are high, for me, I'll have had a tree.
Is he okay?
Maybe he has so much to spend, yes.
Because of the definition, remember we have about 70% in the hands of other players, not government. Now, and for example, you look at how many hospitals are church-based or institution-based like NGOs. But even them, they don't have aid from government. So it means that they must cater for their operational costs.
Felix rightly said, you've given us that background, that yes, as long as we have most of the health facilities in the hands of the private sector, which aims at maximizing profit, then this is how things should move. Actually, maybe one would think that this is their opportune time to maximize profits. But however, healthcare should be a service. Now, appearing before this committee, they made some very important revelations to members of parliament, and I want to take you through this briefly. For example, this was led by the chairman of the task force, that is Abdul Katuntu. But I want to give you a feel. Dr. Richard Lukandwa, that is the managing director of Metro Hospital, said, on average, the hospital spends up to 13 million, up from 9 million that we used to spend per month on water. So he's saying now there's been an increase in water. He also said that they also now spend 57 million, up from 45 million per month on power bills. These are some of the reasons they are saying, maybe because of those in intensive care, they will need more electricity that is shooting up. Then they will need more water supply. We know water is very vital in the times of COVID, regular washing, regular cleaning, and all this. Then also, when they go to breaking down the cost in intensive care, because the members of parliament were saying, how do you account for 3 to 5 million spent on a day? They tell you drugs will cost about 150,000, human resource 850, bed plus vent, that is 560, consumables 385. Then admin, that is administration, that is I think admission plus, that is about 350,000, and imaging 35,000. They give reasons. And this is what happens. The things they are using now have hiked. Well, they used to buy an oxygen cylinder maybe before COVID-19 because demand and supply factors wasn't so much, maybe at about 500. Today, an empty oxygen cylinder will go to about 1.2. Oxygen filling, maybe it was about 50,000. Now it has gone to about 150. So they're saying, yes, you're casting the blame on us, but the issues we should handle, and this is a chain. It will, if you reduce these, then automatically we believe that the trickle-down effect will be applied and we can have costs low.
You see, Robert, truth of the matter is that you cannot discuss this issue away from the aspect of government error. We must also agree that government has erred somewhere in terms of managing healthcare systems in this country. The absence of a well-defined existing system for health services in this country is what brings about that. Now, it is called, you may fear to call it the true stance of statement, that it is extortion. If you want to break down that into various aspects of what, and you'd find to notice that, one, compare that cost to government hospitals. So do you mean to say that government is spending also 3 to 5 million a day on every COVID patient in government hospitals? It brings you back to the aspect of privatization. All right? Now, everywhere in the world, healthcare is never affordable. For some of you who have traveled, you know what it means to treat yourself abroad.
Very expensive.
If you're even able, because not everyone can access medical services abroad. Here you can walk into and buy a Panadol. You can even get a prescription and buy and treat yourself. Elsewhere you cannot, because they look at it as a big aspect of livelihood. But in Uganda, the private sector has for a long time, and not only in medicine, or rather in medical healthcare, has for a long time abused Uganda in terms of charges. Look at transportation. You saw what was happening. Everything is constant. Fuel has not increased, but people come and say a journey of 30,000 now is 150. This whole thing is brought about by the, government is not, the institutions which should be in charge have not informed themselves on quick response. For example, this has been going on for the last how many months? Even when Parliament comes out to discuss, they are doing it sluggishly. You get the point. If you remember the plight of Ugandans, they came out even and asked Kano Nakalema, is it Edith Nakalema, to interest herself in this matter. Now, these things that the hospitals are talking about, like water and electricity and taxes and what, you know, they are not new invasions. They didn't just come in time of COVID. Truth be told.
Yes, Felix, I agree. They are not new invasions. But there is a way COVID has created demand of consumables, demand of what is needed in hospitals. For example, let me just give you, previously, PPEs. In a private hospital, they will tell you need about 2 nurses on a COVID patient and doctors, and each PPE, according to how they are renting, it would go for 200. So if you have 4 of them, how much already is that amount of money? And if they are to change that maybe after 4 hours. Previously, these things were there, but the demand wasn't that much, and the costs were low.
You cannot exonerate government, neither can you exonerate the private sector.
So should government have tax waivers, provide some free of charge?
But you don't waive a tax when someone is receiving money. That then would be unfair. The only reason, you see, if you want to reduce the cost of what hospitals spend on water, how does that trickle down to a patient?
Because it can't be guaranteed.
Unless the private hospitals or the sector in that medical field come down and give you a breakdown of how they can work backward in terms of reducing costs. But also that's not believable. Let them talk about the profit ratios on every aspect. For example, you talk about PPE of 200,000. Between you and me, what is PPE?
Personal protective equipment that a person taking, looking after COVID-19 patient wears to protect themselves against contracting.
Now, what is the use of 4 people on one person? Okay, that's for medics to answer. That's not for us. But we must look at cutting costs. You see, in a time of crisis, the pandemic also goes in terms of pocket also for Ugandans. Do you know how many people have died because they can't actually afford health care? There are many. I have even heard of a story of what some of the hospitals are doing. That when someone is on oxygen and probably has been there for about 3, 4, 5 days and they have earned something, they bring a new one, they remove oxygen from this one and the person dies. And people are confessing those stories. In one of the hospitals in Uganda, electricity went off when people were on oxygen and everyone died who was on ward. Now, who's to blame for that? If we had a standard approach to healthcare as a country, Robert, I can give you an example. One, that we have enough hospitals and by government management. Enough hospitals.
Can we? Or is there a country that has enough hospitals?
What do you mean, can we?
Have government hospitals. Felix, we have regional hospitals, we have health centers.
What's the capacity?
But
of regional hospitals?
I don't think we can reach a situation,
why can't
given
we?
our population, where we have enough government
hospitals. Do you mean to say 45 million people get sick at once?
Definitely not.
So that's what do you mean? When
That's they staggered management. We are finding it hard to put drugs there, to in terms of human resource, even structures and all that.
It is simply because we have not focused on building capacity in that area. And this notion of saying, can we? Yes, we can. Okay, if you can't reach the peak, you can do something towards the peak. You can say out of at least 100, in a spectrum of 100, the country loses about 10. We are able to cover 90%. That's a good discussion. But even up to today, are we able to cover 10%? Let's be honest. If they are telling you that we have how many ICU beds?
Moving towards improving that day by day. More allocation, more money is given to ensure that we have more of
As
that.
I told you yesterday, that if we do not refurbish the medical sector in times of COVID, you will never. Because today, every money that government spends, it should be towards, almost in everything they are spending. If they have, like, let's say 100 million, they will tell you want to spend 50% of this on. If the medical sector does not get well in the pandemic, it will never. Because this is the more evidence that there's need. If you don't have enough, if you don't buy enough ambulances now, if you don't think twice about allocating money to expand our hospitals now, if you don't think of increasing salaries for doctors now, if you don't think of construction of manufacturing, if you don't do those things now, you will never. This, because now you look at such a challenge, that the cost is even less than someone who has traveled abroad for treatment. Because even other countries, like, they don't charge that much. But what is the role of government? Because, Robert, between you and me, the only solace for a wananchi of a citizen is government. Is government. Can government pay that amount for people in private hospitals? No. What can government do? What is our medical system?
We have private and government or public facilities. A person goes for a private facility.
Because the option of government maybe is not in place. For example,
so it's upon choice that if it's your will to...
it's not the will. Kirabo, today they have told you also Mulago is what? So where are you left to go? But if we had enough beds,
the various referral
hospitals, the health centers, don't you think we would have reduced on? But this, because people are riding on monopoly. Someone, Robert, how do you tell me a person who has been admitted for 3 weeks and they have to pay 120 million? And that is for the body of the person who has died. You've heard these stories. They're all over the papers.
Felix, have you ever had an incident and you have to look for a hospital with intensive care, ICU?
I thank God I've never.
Well, one of my friends, some days back when we used to do tours on bikes, we once had an accident and we had to look for intensive care. Even before COVID-19, because this was before COVID-19, I think it was in 2018, if I remember very well. We went to a couple of hospitals and the intensive care units were full. And even before COVID, people may not think that this has just come up. Yes, COVID has, because of the numbers, now people are aware. But this is what it has been. I want to tell you, we got from some private hospital, and it was even through, you know, there are even what they call blockers of ICU units. Person will call so and so, let them see if they can fix for you. It was as exorbitant as it is today. As it is today. We do not have these facilities, and the few Ugandans that have ventured would not have enough. So the few that have ventured to invest into this, that shows they are really expensive to set up, to manage, and also that means when you come for these services, automatically this cost must come back to us.
Let me ask you a question. Do you mean to say the government doesn't have capacity to increase on the probably that kind of treatment in this country? I want you to look around the things we spend money on. There was a supplementary budget passed, if you bother to look at the papers. You know the allocation and where it went. What's more priority? That's why I was telling you earlier, Robert. If we do not have this discussion, and I don't know what the decision was of the commission, the Committee of Parliament, but if we do not confront this head on now, because now the evidence is all over, it would be foolery for any person to argue against increase in terms of health budget. It would be foolery for any person to say that, no, we shouldn't. So how about we use the times of COVID as evidence that our health sector needs a big rise in terms of budgetary allocation? You remember, Robert, that there was a report that came out some time back that in this country we would lose about 10 or above women every day. Maternal health. There was that report that came out. But if you count that on a year, how many do we lose? If every day we lose 10. And this was with related issues to medical attendance.
Felix, before we leave this story, I want us to look also at the appeal to be included in purchasing vaccines as the private practitioners. These private hospitals, so that they work together. Let's purchase these vaccines so that more Ugandans can get vaccinated.
There's that Uganda saying that akasanke kakulema tiantekati mumpenganga.
These guys
you don't fail to slaughter a small bird and you want kalod. Agamba akasanke kakulema okukamanya okukamala ebyoya kati ante mumpenganga. Inganga nebyo yanga bikaluwa because ewanga myaka 10 so you can even cook it for 3 days. What I'm saying is this: if you have manipulated Ugandans to this extent in terms of treatment, how much are they going to sell that jab? Just be honest, Kirabo. How much? You're going to end up having people being immunized or being this jab for about 50 million. And this is a national program. Now, for such a national program, you do not bring into it will definitely on the face of it look like it's segregation. So that's why government is being smart. And this statement, the Honorable Acheng has come out many times to mention, even at inception, they say because they don't know how the private sector will handle. Now, you remember what happened when they vaccinated people water.
Between 100,000 and 200,000 people paying.
And they were vaccinated what?
They got tap water.
Now, tap water, because they dealt with the private, now you want to risk. This is, I find it rushed for them. I don't think they are qualified, depending on how they have acted. Like Balaze or Mururu, they have shown so much greed
When
their festive season knock the door. For them, they are in their season.
It is their season.
People, by the way, if you want to know the truth of what is happening in those hospitals, talk to a person who has lost someone.
Yeah. The
amount they are selling the medicine, oxygen, these things are lies, what they are saying. Those are lies. That the bills,
having a human face.
Well, and what they are saying is wrong. You say that it has increased by 5 million. Whatever increase is about 5 million. But for you, you're charging that 5 million one person every day. You go even, you do your
Yesterday I was speaking to one of my friend, that is Professor Simeon Kayua, who recovered from COVID-19. We thank the Lord. And he broke down almost in tears when he was narrating what he went through. Told me, son, 30 million in just a short period of time. I thank the grace of God for well wishes from my friends that were able to raise this money. But it was really a pain for me to recover. Finally, Felix, the PS, that is Ministry of Health, Dr. Diana Atwine, one time we were discussing why we have these exorbitant fees. And he said bad laws. She said bad laws. The bad laws in place make it almost impossible for government to crack the whip on these health facilities.
Kirabo. Whose government? Whose government?
The president.
Are you aware that
cabinet,
that this week
various
government passed a law that would make it probably an offense for someone not to have a mask?
Yes.
Someone putting out in the chin. What?
Go to Chitalia or Chigo for your 2 months.
What did it take them to make that law?
Such an instrument by the minister.
No, what did it take them?
They sat, approved it, and it was...
Because they had interest.
There was a will.
There was interest. Kati, just telling us, don't make the law look like it is when it comes to law of that regulates hospitals. That law is for Cuba or Nigeria. We can't touch it. How? Where is the heart of government? And this, and one person was saying that is a bitter pill because some of these hospitals are owned by government officials. So you touch a Kirabo hospital and they will slap you. That's the thing. So this whole thing of the Panseke coming out to say that the law, if government has a will, now we have dealt with laws here, even with nationwide protests, but we had to make those laws. So if the heart of these people is with Ugandans, there's no way. There's no way. For example, what law did Madam Nakalema use to get into the transport issue? What law?
Because she would have still said, this is a private sector,
because by the way,
it's a liberal economy, there is demand and supply.
Yes, whatever she was doing was partially illegal, but she did it for the good of the nation. The outcry was too much. So this thing of laws, I think, and that's why I've always said, as yesterday I said, looking at all these stories and reading whatever is happening in the news, and matters of fact, by the way, for you, a Ugandan who's out there at home, that should give you more reason to take care of yourself.
Yes.
You should protect yourself against COVID-19, because what's happening in this particular time in Uganda, you poor people of Uganda, we can't, you cannot afford to go for private medication. The government hospitals also will not take you, because true, as a matter of fact, in as much as they are free, there's a cost. There are a lot of, Kirabo has told you, they are brokers, they are what? All these people. Kakati gwe, mwana wani, who knows you? The only person, the only thing that can save you is protecting yourself. Put on your mask, wash your hands, zunga. Don't just move far.
Going to a trading center.
Avoid contracting COVID-19. Yes. Because the discussion we are having here is the reality of the matter. Only that these papers and the stories you see on TV are juicy. Bagezako sigako butter, as we normally say in Uganda. But the best thing for us to do, and generally 95% of Ugandans, you cannot afford COVID medication. That's a matter of fact. So avoid getting or exposing yourself to contracting COVID-19, if they are contributing money for people like Mr. Kayiwa, Professor Kayiwa, at his level, you who knows you?
Well, said by Felix Nkunda, prevention is always better than cure. Right from primary school, we've had this. Please do not do this, because when you look for the cure, when you look for the treatment, you may not survive. But the good news is we know what to do to prevent this. And we call upon government that let's further interest ourselves in these private hospitals. How do we bring the costs down? As government passes more monies, we also hope and pray that they'll be put to proper use. Because we must commend government. There's been so much direction in putting funds towards fighting COVID-19, improving the health sector. The challenge would be, have these funds been put to proper use? Or will we see after a time commissions of inquiry and Ugandans will face again the bitter pill that some of this money was misallocated, swindled, we got poor quality, maybe beds and all that. We hope and pray that when we work together, responsible enough, we'll flatten the curve and kick COVID out of Uganda. But before that, please have your mask on, social distance, regular wash of your hands, and ensure you desist from going into crowded, congested areas, because that is a fertile ground for the spread of COVID-19. We return with what is trending in the print media. Keep it with us.
This is Good Morning Uganda.
Airtel Uganda has the best and most affordable rates when it comes to withdrawing and sending money. Withdraw money for as low as 330 shillings up to a maximum of 12,500 shillings. Sending money is just as affordable as ever. Absolutely unbeatable. Use Airtel Money on the most affordable network with the largest network of Airtel Money branches in Uganda. Dial *185# to get started. Airtel Money. Simple, secure, borderless.
Echa COVID-19 chijja kugwa. If we get vaccinated now, observe social distancing, wear masks properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
It's no secret that ICT makes learning easy.
The strides made in our field couldn't be possible without it.
And now we can watch our favorite show.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC supports local content and innovations. Driving the development of a robust communication sector in Uganda is Uganda Communications Commission.
This is Good Morning Uganda.
Well, one time I had a discussion with my father, and he told me that during the war, that is the liberation struggle, there was a time when a job was not that important, when all that mattered was being alive. And sometimes thieves used to break into, or the government forces then would break in, and people would tell them, please take everything but spare my life. Right now, many people would want to come to their places of work, some even violating SOPs to earn a living. But remember, once you contract COVID-19, then you will know that all these you've been yearning for and exposing your life at risk are meaningless. It's only life. So please, let's observe the SOPs. Let's ensure that our greatest achievement is staying alive. Senka Tukaluk is watching, and I have a message for you, Felix, here. He says, thank you, Robert and Felix. The only thing I waited for Felix to say was that government should ban those in the health field working with government to set up private hospitals.
Yeah, by the way.
Senka Tukaluk, thank you so much for watching the show. He says, as long as that stands, then Felix and Robert, that is a dream come true. Well, Senka Tuka, that is his view of things. And
Smart
it's very
man.
true.
Thank you so much for watching. Senka Tuka.
And of course, today is also Tone Kentchaze's birthday. Happy birthday to you, Tone Kentchaze, and thank you so much for always watching Good Morning Uganda and making Ugandans entertained and enjoying their mornings with the magic breakfast. It is time we look at some
of those tallest, the competitors of Ruben in terms of height.
Actually, I always wonder, Ruben and Kent, who is taller?
This all must have been sneaked from the northern part of this country. Sudan. We are about to trace your...
I highly believe, and even when you should look at the skin complexion, I think they come from both.
That would qualify for Ruben.
Even
but not Kent. You may be shocked when Ruben's other name is Okwi, Okwa, Obong, but we will find out. So this is Chibida Ngoma.
Well, let's look into the papers, beginning with the New Vision, where the government gives nurses more pay. And there's a picture of a nurse with a smile. More pay there for the nurses. Then speed up East African Federation. Ruto asks Museveni. That is during the launch here. We are now aware anytime we will see the East African community move to greater heights when it comes to treatment of diseases. Then here we still see that is in the education column, chemistry, biology and English, that is for all level. And how Lutaya announced that is HIV status. But there's something interesting on the New Vision. Felix.
That professor,
man, picture I'm seeing.
Lost.
Isn't this? I'm not so sure.
The American professor.
Could he be the one?
I don't know. I really don't know. If he's the one, he's also making us doubt. He's playing hide and seek. He surfaces and resurfaces.
I hope he's not right. Let me reserve my comments because I'm not so sure. But we had a similar man with this hat.
Well, of course, now with the Daily Monitor, government cuts budget by 40% over COVID-19. Ministers' department and agencies face budget cuts as government looks around for money to shore up efforts to fight coronavirus and cushion the already weak economy against the brutal plans of the pandemic. Now, of course, Cabinet approves 600 billion supplementary spending for COVID-19 and contingencies. Now, of course, the allocations will go as follows. Contingency will take 228 billion. Health will take 206 billion. Local governments 53.7. Relief 53.5. Security 50 billion. Security 50 billion. ICT 8.1 billion. Okay. And now, of course, still Agri awarded the master of all trends. Now, Museveni commissions work for vaccine factory there. But of course, also there's a home pull-out, indoor timeless kitchen trends, and COVID-19, 21,000 people to get relief money tomorrow. Of course, there's a lizard who's saying, when shall all 500 get? Okay, over 21,000 to get 500.
People are eager. Felix,
anyway,
talking about that money, yesterday people on their mobile phones, today, but until government came out and said...
I think everyone's phone must be charged.
Everyone, wait for Thursday. That is when you're going to begin getting this money.
You're going to have people who are going to die out of pressure. Thursday is tomorrow.
And you see what is hard? That people are so much focused on this money that even they are going to become less productive.
People are going to die.
People are going to become...
If Nabanya can just do a surprise, again, we shall do it next week.
Do you remember what had gone around social media that because of the reduced cases of COVID-19, these monies are not going to be given? My friend.
But anyway, inside the papers, we see people in the news. Agri Awori, former ICT and presidential candidate Awori, died on Monday afternoon at the age of 82 at a private hospital in Nile. Now, also Professor Patrick Ongwen, the developer of COVID-X herbal drug, has capped the market price to at least 12,000 and also warns extortion by Ugandans. Now, of course, from the archives is a photo of former Investment Authority Director Margaret Chigozi sharing a light moment with the International Monetary Fund officials there. But also today in history, Buganda Prince Toby dies mysteriously, and in history, terrorist attack London transit system. There they also give you the statistics of COVID-19. Now, of course, most important for us, we have recoveries have increased to 56,000. That's a good one, and at least we have hit the mark of 1,027,000 vaccinated people.
Looking at the new vision, still we see Uganda trackers COVID-19 statistics, where new confirmed cases 438. Thank you for responding to the SOPs, because we are reducing new infections. The new death 29. Still there is a reduction. Let's keep up. And when we look at total deaths so far, it is 1,995. Almost hitting 2,000 that have succumbed to COVID-19 in this country. Just remind you of the symptoms. If you have a fever, a cough, shortness of breath, sore throat, and a headache. Now a big question here, if I do not get effects after vaccination, does it mean the vaccine is fake? Many people have some effects and they vary person to person depending on your immune system or how the jab reacts. So one is wondering, in case I'm so much normal, what happens? Has it not worked? Then know your member of parliament. They have Julius Akon, that is MP Otuke East constituency. Today in history, it was on this date and same month, but the year 2006, when President Museveni names peace team. And still in July 7th, the year 1976, when Dora Broch was murdered. She was one of the early British hostages of the hijacked flight 139, an Air France plane hijacked from, that is Athens in June, that is 26th of June, the year 1976. Yes, Felix, in the world of
now, sports. Of course, in sports, Mogamu cycle nearly complete, but also that coaches Brian Makalama and Bodi Musinguzi have trusted Mogamu with the mantle that implies that he has passed the auditions. Well, of course, also a silverback count on depth, that is Wainwright, still stand out, but also CAF Championship, women debut, FIFA Super League champion Lady Doves anxiously wait draw for Sekafa Zono. Now, Nakai to lead biggest ever female contingent there, and Awori, an Olympian of great distinction, and SC Villa set to congregate the Forge roadmap for presidential poll. And Three Lions aim to reveal in special Wembley moment. There we see England and Denmark. Something quite interesting for us to do catch.
In the New Vision Sport, Brazil reaches, that is the finals, the Copa America 2021. And still we look at Crane's coach has some work ahead. And also we look at a few days, 16 days to go to the Olympics. How is Team Uganda ready to ensure it does as planned when finally they win a couple of medals there for us? Boxing for the lovers, still more is there. But don't forget, Ruben will be here to give you all the updates in the world of sports and catch up with him regarding sports updates. Felix, something interesting when we see the professor talk about market price for COVID-19. There was a report that came out yesterday that COVID-X actually, when it comes to pharmacies in Uganda and in Kampala, is almost out of stock. So how do you think that him coming and stating a market price is really going to be reflected at how much Ugandans buy Covidex at the end of the day?
No, why not? He's the maker. He knows the price of retail and the price of, because, and this is a good thing. He has come out to give information because as a producer, the purpose is to cure people. It's not to make people fail to act. You see, this is what we're talking about, extortion. Now someone was saying Covidex goes for 60,000. But what?
I know a friend, we bought it in Machindi at 80,000, just a small bottle.
That's simply extortion, and I find that quite gullible. Ugandan sometimes, as the word goes, that you overdo things. So you sell your things 80,000 and you wait to have it in stock. After COVID is gone, you wait, you see if you can sell it to anyone.
But there's a lot of demand and supply. We did that in economics.
Well, of course, let's look at the Daily Nation briefly, and the headlines, of course, they come out to say State House co-principal want ODM leader out of race, and Raila might term for NASA trial there. They give a highlights on what he's to bring on the table, but also something to watch out for. That is watch out for TSC Trump. A session tells new leader, and of course they talk about tourism in terms of how much it has grown in the region, but also we're looking at the visit of Deputy Ruto into Uganda. What was yesterday where we saw him sharing a light moment with the President of Uganda, and endeavors to enforce the fast track of the East African community. Well, that and much more is what you can be able to look at when you get yourself a copy of the papers, the Daily Nation, Daily Monitor, and the New Vision.
But before I let you go, have you ever heard of what they once called the Temangalo saga, and something came out, willing buyer, willing seller?
Well, it's also governed under the principle of contractual relation. I think the four-corner rule that, or even under the different contextuals of consideration. Now, consideration may not be necessarily adequate, but probably sufficient. That is one of the things that has broken down nations, and by far third world countries, and that's what we were discussing earlier. If institutions can't be protected, then you cannot also protect the consumers. And that's a bad thing and risky.
Well, we'll go for a break, and when we return, we'll give you more regarding weather and traffic. Keep it on UBC TV.
This is Good Morning Uganda.
When you talk about our motherland Uganda, the pearl of Africa, you cannot fail to smile because of the smile that fills the faces of the citizens. Our nice good weather and nature that sustains us all, that enables us all to continue each in their own way, because we are all different even according to each individual's work. But what joins us to become one person is the sweetness from the flavored drink Alleluia Jingati drink and Alleluia Tamarind drink. The flavor that quenches your thirst while at the same time treating and healing your body, because it is 100% natural. Enjoy the drink that has got the tamarind juice in it. Made by Alleluia Reflexology, Healthy Solutions and Nutritional Research Center Limited. Get yourself a bottle of Alleluia from all shops around.
It's no secret that ICT makes learning easy.
The strides made in our field couldn't be possible without it.
And now we can watch our favorite shows.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC supports local content and innovations. Driving the development of a robust communication sector in Uganda is Uganda Communications Commission.
This is Good Morning Uganda.
Now, well, of course, there's so much for us to do, learn daily about automobiles. Now, for some of you who ride or for those of you who drive. Now, getting yourself into the heart of Kampala or getting ready for any form of distance in times of the pandemic, you must also have a permit to be on the road. Now, many a times, many people have erred and have ended up in police cells or their cars being impounded. Please do not get yourself on the road if you know you're not supposed to be on the road. The other alternative for some of you who actually may not be able to drive is to walk. It has also been proved that it's one of the best methods of working out as long as you're doing it consistently. But some of you who can also ride, some of you have bicycles, you can use that to get on the road. Now, today we just want to share with you a tip of people who are pedestrian users of the road. I have noticed over time that many of you people who walk beside the road or ride along the road, ride with your headphones or earphones in your ears. Now, that is very, very risky because you're not able to get any form of signal from other road users. For example, if someone hooted for you, you wouldn't hear because you're listening to something or you can't actually tell what they are saying or what error you have made. Secondly, there's distraction of mind. That because you are listening to something, it could be music, it could be a sermon, it could be anything. Now, that particular one, it's hard for you to sort of pick the information and concentrate on the road. I have seen a scenario where someone is listening to music and they are walking and they end up just walking into the road. It's not good practice for you to have conflicted attention when you are on the road as a pedestrian. One of the things that we are taught when we are driving is something called defensive driving. I don't know who teaches defensive walking or probably riding, but this is a tip I want to share with you for some of you who will hit the road either walking or either riding. Be keen and avoid any form of distraction. Do not look aside. Focus on what you're riding on and also avoid having earphones and headsets as you ride. But also another common practice, people are on phone as they ride. Can you imagine how you ride a bicycle and how you ride a motorcycle, yet you're using your phone? You know you're using a machine or an object or a bicycle that has supposed to be held by two hands, but now you're using one. It's very destructive. So take care of yourselves, avoid any other road accidents, and of course be safe. Let us fight COVID. We can only fight alive. It is unfortunate that you have been able to skip COVID and you die of a very mere accident or get to lose your leg or limb or what. But now, Molen is on the other side and ready to take us through also something quite interesting, nature at its best, but also something to do with food. Good morning, Molen.
Good morning, Felix. Talking about food, which is one of those things we really need to live in this pandemic. Yes. It is a good morning here.
Yeah, I can see you clearly look lovely in this morning. You haven't known the hassle of getting to this city. But it's good to have you, and I can't wait to listen to what you're about to share with us today. And I will leave the stage, as we normally used to say when we were young, for you to showcase the best of it.
Yes, thank you very much, Felix, and good morning to you, our viewers here at Good Morning Uganda and UBC. My name is Molen Kenyana, and I will be taking you through weather prospects that we have here in Uganda and also across the world. And on the international scene, what is trending now, we are talking about Tropical Storm Elsa. We did talk about that yesterday, but now it has been upgraded into hurricane status, and that means that more devastating winds and also more heavy rains expected. That is across the coast of Florida, Miami, still bringing in devastating effects over there. And even then, we are looking at more areas across the coast, that is Florida, likely to be affected as the hurricane
Now Elsa comes in and making landfall today, and in 3 hours time, according to the reports that we have and the forecast from the Weather Channel, they are indicating just a few hours from now that hurricane will be making landfall across much of Florida, already bringing in heavy rains and flooding across the city. But the good news is that most people have been aware and evacuations were done. Although, of course, there are those people that kind of remain even when the alerts are there. And so far, we have had reports of missing people still across the coastal Florida. But we will follow up more on that report, and we'll be getting those during our daily weather reports here. Now, we are talking about also the climate crisis across the world, and now it is here in southern Madagascar on the African scene. Looking at drought specifically, there has been drought instances over Madagascar for months now, and it has led to people starving. People have lost their lives due to lack of food. That is in southern Madagascar, and we're looking at most people, a lot of population in southern Madagascar do depend on agriculture. Now, what happens with drought is that the people no longer have rain to sustain agricultural activities, hence they will lack food. And now I'm happy that the World Food Program has actually come over to look at how they can support in terms of food to the vulnerable communities, mostly women, children, and the entire population, actually, because a lot of what is happening now is that people have run out of food, and this has been going on for months. But we also have reports connecting this kind of incidents to climate change, because this is breaking record. We haven't had this kind of drought across Madagascar, taking this long, and also stressing communities in terms of food. And this is actually why we continue to call for a climate emergency, because people are dying. People do not have what to eat. And much of Africa, even us here in Uganda, we do depend on agriculture. Imagine if that was to be taken away, if we could no longer sustain that in terms of our agricultural activities, that would really lead to devastating effects. And you look at people losing their lives over food. We need to already declare what we're seeing as a climate crisis, not just a crisis, but an emergency. We need to come together and make sure such extreme weather events are not happening anymore. Because when you talk about extreme weather events, we're not looking just about heavy rains, the flooding, the mudslides, even drought. And I remember even years back, we did have such instances of drought, especially across Karamoja, across northern Uganda. And most parts of Africa have actually had to deal with this drought, also for northwestern Kenya. Now, this is something that is continuing. The extreme and also the frequency of drought incidences are much across Africa. This is where we are calling on governments and policymakers to look at climate change as an emergency. This, what you're looking at the screen, we did have heavy rains yesterday across southwestern Uganda, and a lot of crops were really affected. Acres and acres of crops were affected. We also did have houses that were affected by the heavy storms yesterday. That is in Chirundo, in Rubugiri, Kisoro, that is across the Kigezi Highlands. That is one of the homes that were affected. We did see more crops that were affected by these heavy storms. We had some of that report coming in through from the Uganda Red Cross, also putting light on that, what happened yesterday. Now, as these rains continue, especially for Western Uganda, we did talk about that yesterday, do look out for possibilities of this. And if there is a way to reinforce your roofs, this is the perfect time to do that kind of reinforcement and make sure that you can minimize the damage. Now, there isn't much you can do, especially looking at crops, but for the houses, you can find a way of reinforcing those roofs, like I mentioned, and also make sure that you look out for the possibility of lightning as we talk about thunder showers and thunderstorms still expected, most especially across Western Uganda, across the Karamoja region, and also for Mount Elgon Highlands. These are areas that are still on alert for likelihood of heavy rains and also with strong winds. Now, what we saw today over the satellites still indicating what we have as mostly in terms of sunny and cloudy conditions this morning across Uganda, although we did start off with some rainy conditions across Midwestern Uganda, that is across Fort Portal, and also for the Lake Victoria Basin, we did have that rainy system that is starting across Lake Victoria, but mostly it is moving, propagating westwards and southwards, and that will be bringing us rains, especially across the western part of Lake Victoria. But for now, it is mainly cloudy conditions, even here in Kampala and across Wakiso, Entebbe. But we do have more rains in our forecast, as we shall be looking at our forecast for this morning. But most areas across northern Uganda, from the satellite, you can see they are dealing with mostly cloudy conditions. Also, we do expect rains there this morning, and also later into the afternoon we shall be seeing the temperatures that we do expect across different areas in regards to what we have in our forecast this morning. Also for Mount Elgon Highlands, that is where we have like Mbale, we are seeing mostly cloudy conditions over there. That could also bring us rains over most areas. Now we'll start off with Central Lake Victoria Basin, where we have Mukono, Kampala, Entebbe, Wakiso, Uyikwe, and Mbiji. We are forecasting isolated thunder showers. Now those are expected over just about 20% of the forecast area, but will be at a chilly 25 degrees centigrade. That rainy system is expected this morning and later into the afternoon. Now Western Lake Victoria Basin, we already are seeing that rainy system headed over there. That is across Masaka, Rakai, Rengo, Kalisizo, Sembabule, and Lyantonde. Still forecasting thunder showers over there, but quite also isolated. Those will be over a few places, and temperatures going up to 26 degrees centigrade. Now, western parts of Central, which is where we have Mityana, Mubende, Chivoga, and Chankwanzi, we are forecasting intervals of sunny and cloudy conditions this morning, and most areas will be seeing mostly a mix of clouds and sunshine at 27 degrees centigrade. Quite moderate winds that might bring in a chilly kind of condition, but still a warm morning. Now, eastern parts of Central, where we have Luwero, Nakaseke, and Nakasongola, we're forecasting isolated showers. Those will be really light across a few places at a warm 27 degrees centigrade, quite some moderate winds over there. Now, also more that we have in terms of our forecasts for Southwestern Uganda, we are forecasting sunny intervals. That is a mix of clouds and sunshine across Bweju, across Bosheni, Ibanda, and Barara, Isinjiro, Shema at a warm 27 degrees centigrade. That area should look out for more rains later in the afternoon. Now, West Nile, we already have those cloudy conditions starting to drop over there. That is where we have Arua, Nebi, Zombo, Koboko. We are forecasting isolated showers and quite a chilly morning over there at 24 degrees centigrade. Will feel kind of cold, also with moderate winds expected. Now, Central North, which is where we have Jumani, Gulu, Kitgum, Padel, and Lamo, we are forecasting isolated thunder showers. Also, the system has already started to form up across that area, and quite cold temperatures at 25 with very light winds. Now, Northern Choga, which is where we have Apache, we have Lira, or 2K, Amolata in that category. We are still forecasting isolated showers at a pleasant 26 degrees centigrade. That area should also look out for more rains coming in through later in the afternoon, but in the morning we will have rains just over a few places. Now, Midwestern Uganda, which is where we have Hoima, we have Bulisa, we have Masindi in that category, Chiriandongo, we are also forecasting thunder showers this morning across that area. We are already seeing clouds developing across Midwestern Uganda. Temperatures will be at 25, quite a cold morning as well, but with very light winds in the forecast. Northern Rwenzori, where we have Kabarore, Toroko, we do have Kamwenge, we have Kegegwa in that category. We are forecasting isolated showers over the area, but also a very cool morning at 24 degrees centigrade. Actually, that might feel really cold for this area with very light winds expected. Now, Kasese, Bwera, we are forecasting isolated showers. Those will be only over a few places. Up to 20% of this area will be seeing showers with very light winds at 26 degrees centigrade. Now, Kigezi Highlands, which is where we have Kabale, this is an area where we had those heavy rains last evening, destroying acres of crops. We do have mostly right now a mix of clouds and sunshine, but still do look out for those rains that are forecasted in the afternoon. Those will be coming your way later in the evening. That is also something to really look out for. Now, for Eastern Choga, Serere, Soroti, Katakwi, Amuria in that category. We have Kumi, we have Kariamaido. We are forecasting isolated thunder showers this morning across that area. Temperatures will be at a pleasant 26 degrees centigrade with light winds in the forecast. Now, the Karamoja region, where we have Kotido, we have Napak, Moroto, Nakapiripirit in that category. We are forecasting isolated thunder showers. Still 20% of the forecast area will be seeing these rains at 25 degrees centigrade. Quite a chilly morning for the Karamoja region there. But we do expect temperatures to go up in the afternoon, at least up to 29 to 30 degrees Celsius. And looking at Mount Elgon Highlands, where we have Mbale, we have Sironko, Bududa in that category. We are forecasting still a cold morning across that area at 24 degrees centigrade, and we have isolated showers. Most of those will clear as the day goes on. Same for Eastern Lowlands, where we have Budaka, where we have Palisa, Butaleja. We are forecasting isolated showers at 26 degrees centigrade for this morning, but we will see a clearing trend in the afternoon where those will clear into intervals of sunny and cloudy conditions. For now, most areas within the country are still having mostly cloudy conditions. We have the sun coming through, but we will be seeing those rains that we've had in the forecast as the morning goes through, and more rain still expected in the afternoon across mostly the western stretch and also parts of northern Uganda, but elsewhere we can expect mostly a clearing trend now. Thank you very much for being with us in terms of weather and climate. We'll be looking at more in our segments now. For now, I will leave you with a Good Morning Uganda agenda coming up. We'll also be having sports coming up with Ruben. Last night was very interesting, and for the last few hours, I think I was also interested seeing what Jorginho did. That penalty was kind of cool and calm and composed. I'm interested to see what Ruben has to say about that and more in terms of Euro 2020, and also now that we're talking about Copa America 2021. Ruben will be here to take you through. We'll also have Good Morning Uganda Extra with Semakula Jagenda. You'll also be here, but you can also catch the conversation online. We are streaming live on YouTube. That is UBC Television Uganda. My name is Molin Kenyana, wishing you a good morning.
This is Good Morning Uganda.
When you talk about